Good afternoon, everyone. I'm Vicki Wilkins, Dean of School of Public Affairs here at American University, and I want to welcome you to today's event, Election 2020, Beyond the Talking Points, How do we move to bipartisan solutions? I welcome you here. This event is sponsored by the School of Public Affairs, No Labels, and the Sign Institute for Policy and Politics. We're very fortunate today to have a moderator and 3 of our faculty members here to talk about policy areas. I'm happy to welcome back our moderator, Ryan Clancy. Ryan is the chief strategist at No Labels. You may have heard of No Labels. It's a groundbreaking movement led by Americans who embrace the new politics of problem solving and are collaborating to find common sense, nonpartisan solutions to our toughest challenges. It's a real honor to welcome Ryan back. We hosted him a couple years ago. He led a great conversation with a bunch of our prospective students over the summer. They, for about 90 minutes, talked about the policy solutions and the trade-offs associated with them. I was so impressed as he left. I was just telling him in the green room that I said the minute I could, I wanted to hire Ryan Clancy to be part of the School of Public Affairs. I know you're going to enjoy today's conversation and learn a lot about the policies facing us and the decisions we have at this time and how we really can press for the common sense solutions and bipartisan solutions that it will take to answer today's most critical challenges. So I'm going to turn the floor over to Ryan. Ryan, welcome, and thank you again for being with us.
Thank you so much, Vicki, for having me, and thank all of you for joining us today. As Vicki mentioned, we're very lucky to have 3 great scholars from American to answer some of these questions. As Vicki mentioned, No Labels has this mission, which may seem sort of impossible in this current political moment, which is to find some way to bring these warring tribes, which are our political parties, together to actually solve problems that matter and to make people's lives better. The only way you can do that is by actually starting off with a base of facts. There's a famous quote from Daniel Patrick Moynihan, the senator from New York, and he said, "We are all entitled to our own opinion, but not our own facts." And unfortunately, today, we all do have our own facts, and that makes it very tough to get to any common ground. It's hard to agree where you're gonna go as a country if you don't even agree where you are. And so with that in mind, we want to have a conversation today with these exceptional AU scholars about some of the most pressing issues that the country is talking about at the moment that are going to be on the agenda for whomever is the president and Congress in early 2021. And so I'm looking forward to a great discussion. A little bit of housekeeping really quick before we get started. All of you at the moment are muted. If you would like to answer a question, you can just type it into the chat function. Make sure you include your name if it's not included on your handle. And I'll be happy to ask it of the guests as we go through the program here. To start though, what I'd like to do is ask a single opening question to each of our 3 guests pertaining to their particular area of expertise. They're going to give you a brief answer on that. And then we're going to open it up for a broader discussion, which I'll moderate, and we'll be happy to answer any questions that you might have. So why don't we start with Kareem Jordan. Kareem is a graduate program director and associate professor at AU, who has written extensively about the role of race in criminal court sentencing and juvenile court outcomes. So Kareem, I want to start with this. We hear the phrase systemic racism quite a bit of late, and I want to know, is there a common acceptance among criminal justice scholars for one, what the phrase systemic racism actually means, and 2, whether it is indeed pervasive in America?
Thank you for the question, Ryan, and I'll definitely try to be brief. In terms of, is there agreement in terms of what systemic racism is? That's actually the easy question. Yes. Yes. So there is agreement in terms of what it is. You know, systemic racism being built into the institutions, into our criminal justice, institutions. at all stages, all parts of the process, from policing to prosecutions to what happens at court, meaning race plays a role at every one of the stages that are there. So yes, everybody definitely does agree in terms of what it is. But here's the problem, though: does everyone agree about the extent to which it exists, or whether or not it does exist? There is far disagreement on that one. You know, when it comes to criminal justice, you will definitely see a disparity there. You will find that, especially Black folks and brown folks, are more likely to be arrested, more likely to be convicted, more likely to be incarcerated. So you definitely have a disparity there. And that's a fact. The issue is, what is the source of that disparity? Is it due to Black folks? Is it due to the Latinx community? Is it that they're offending more, and that's what's causing that actual disparity to exist? Or is it due to discrimination? And that's typically where there is a significant amount of disagreement, even amongst even among the scholars out there. So there is a wide amount of disagreement there. Now, the one part that I will say is the reason why there is a lot of disagreement out there is sometimes people tend to look at criminal justice in terms of what's going on right now. So is discrimination, is it an active thing that's going on now? Say we're past Jim Crow, the 50s, the 60s, and slavery was over 150 years ago. You know, so folks will say that and say, well, discrimination is no longer there. The problem is that people look at, you know, you can't look at these types of issues as though it's in the vacuum. You have to look at it in terms of the historical context of what goes on. Criminal justice was built on issues with race and discrimination. Police and the courts at one point in time was built as the institution to control Black folks, and that's what lead to the structure and the institution that we have to this day. So is there agreement in terms of what systemic racism is? Yes. Is there agreement is there agreement in terms of the degree to which it exists and whether or not it does exist? Definitely not at all. So I'll stop there because I'm sure we're going to get some questions and answers, but thank you for the question.
Thanks, Kareem, and much more to talk about in terms of finding areas where maybe there is agreement and potential for solutions on some of the issues you described. Obviously, Kareem, when you talk about systemic racism, we're not just talking about the criminal justice system. We are talking about other systems and institutions, one of which involves the educational system. And for a question on that, I want to ask Taryn Morrissey. Dr. Morrissey is an SPA Dean's Scholar Associate Professor at AU, and her work centers on examining and improving public policies for vulnerable children. So, Taryn, what I want to ask you is, there's been a lot of recent reporting now that we're about 6 weeks back, or a month back into the school year, that some of the COVID-related school closures are really harming the development of kids, particularly those in low-income communities. Number one is, besides the anecdotal evidence we're seeing, are you seeing broader evidence that this is happening? And if we are, how should our policymakers be thinking about this problem as we go into the flu season and what a lot of people worry is going to be an upsurge in COVID cases in the months ahead?
Right, exactly. Well, first, thank you for co-hosting this panel to No Labels and SPA. This is a really important discussion. And the short answer to your question is yes. The pandemic, the resulting school closures, the resulting economic downturn has had dramatic and harmful effects for children, and disproportionately for children in low-income families and for children of color. And importantly, many of these effects are expected to be lasting. This isn't going away anytime soon. In education, for example, the COVID slide from spring 2020 alone was estimated of 1 year of lost learning in the lower grades, with even greater loss among lower income children. And this doesn't include what has or hasn't happened in the fall. And missing school, we know from previous research on things like snow days and absences are associated with poor educational, physical, and mental health outcomes. And then combine it with the trauma of experiencing COVID, with anxiety, with all the economic hardship that many children are experiencing. And this is going to have a multi-general, cascade of income inequality and problems. So, I mean, low education is associated with poor health in the long term, including early mortality. So these are not, these are pretty lasting and really important effects. And these harms aren't evenly experienced. I think this is really important to know. I mean, given the virus's disproportionate toll on Black communities and systemic racism, as Kareem was just talking about, and children of color are likely to face even greater adversity and lasting impacts. And so many families are struggling to manage remote learning. I have 2 young children. It's really hard for us. Many don't have access to reliable broadband or devices. And because of how we fund K-12 education, low-income school districts have the double whammy of having more low-income families that struggle to buy these devices, as well as fewer resources to purchase devices for students. Many children are missing schools because they need to care for their siblings or they need to work themselves. And so many children, especially young children who are learning remotely, are missing out on social interactions that are really key to their development, particularly for social skills. Yet we know that many private schools are open to in-person learning, which will widen socioeconomic disparities and the achievement gap. And as I mentioned, so many children are experiencing other harmful effects, whether it's economic adversity, food insecurity, family illness and stress, child abuse and neglect. All of these issues have increased during the pandemic, and children are lacking these safe havens of schools and peer networks. But these harms are not inevitable. And so when you talk about solutions, which is really key, I think it's important to note that the solutions to opening schools and preventing harms from children, they don't involve doing rocket science. Really, it takes political will and it takes money. It takes resources for devices, for broadband, for remote learning, and then for improved ventilation, improved space, PPE and staff for in-person learning. Families need resources too. I mean, our safety net has not changed despite the worst economic downturn since the Great Depression. I mean, we just see SNAP enrollment has increased from 17% from February to August, but eligibility and benefits haven't met today's realities. And so I think, states and cities can't do this alone. They're really struggling with tight budgets, and we need federal action and resources. And this will help families across rural areas, urban areas, and of all political stripes. Everybody needs help now, particularly those in low-income families. So we really need to put children and families at the center of the political discussion.
Okay. That leads me actually to my third opening question, and this is for Aparna Soni. Aparna is an assistant professor in public administration and policy at AU, and she studies the impact of public programs and policies on individuals' health. I mean, Aparna, the whole discussion we just had about school closures and its impact, part of the reason we're even in this situation in the first place is because of the politicization of COVID and public health in general. And of course, the most notable example of that is that the simple ask of wearing a mask is now seen as a political statement. And so my question for you is, how did we get to this place where even the most fundamental tenets of public health are a political question and not a policy question? And most importantly, how do we get out of this?
Sure, thanks Ryan for moderating and for the question. I agree, it's really unfortunate that engaging in protective behaviors like wearing masks has become so linked with political affiliation. A recent survey by Pew found that 80% of liberal Democrats said that they wore masks most of the time versus only 50% of conservative Republicans. In terms of how we got here, I think there are several explanations. So first, in the initial days of the pandemic back in March, there was some conflicting information regarding masks, even from the CDC and Surgeon General. So at that time, if we remember, health officials said that ordinary people should stop buying masks because of potential shortages for healthcare workers, people who really need them. Of course, the virus spread much more rapidly than probably anyone anticipated, and mask production increased, so the message quickly changed. By early April, the CDC said that everybody should be wearing face masks in public, but maybe for some people there was some confusion or resentment around that changing recommendation. As a researcher, I'd also point to the possibility of confounding variables that we should be careful about. So the states that were really hard hit by COVID early on tended to be those with higher Democrat populations, for example, New York, California. So maybe it was the local severity of the pandemic in my city or in my state more so than my political affiliation that convinced me to wear a mask in public. Similarly, education is another possible correlate. College graduates are more likely to wear masks, and we also know that there's this correlation between education and political affiliation. So how do we tease out the independent effect of being Democrat? But some preliminary work shows that even after we control for these confounding variables, the difference between Democrats and Republicans becomes smaller, but it's still there. And of course, there's certainly a major difference in the rhetoric and behavior of top Republican leaders versus top Democrat leaders. I'm definitely not saying that the politicization doesn't exist, but just that the differences might not be quite so stark when we control for these other things. Another important reason could be the overall declining trust in our political leaders and health officials. So in some of the work that I'm doing with colleagues here at SPA, we found that the percent of Americans who trust government plummeted by 50% since March. And this low trust is a real problem because it means that people are probably less likely to follow public health recommendations and mandates. Where we get our information from could play a role as well. In that same study, we found that a quarter of Americans actually trust social media to provide accurate information about COVID. And we know that pretty much anyone can promote whatever message they want on social media. So for somebody who might have some cognitive dissonance regarding masks, misinformation on social media could help them justify their decision to not wear them. And then thinking about where we go from here, I think we can draw some hope from the data. First of all, adherence to mask wearing is not 0% for either political group, right? The numbers were about 80% for Democrats and 50% for Republicans. So it's certainly not true that all Democrats wear masks and all Republicans don't, even if that's sometimes the impression that we get from the media. It's also reassuring that trust levels we found in that study are actually relatively high for local health officials and employers, actually. So although they're plummeting for the federal levels of government, they're actually fairly stable for local levels. And all these institutions, local health officials, local government, they can probably leverage this high trust to get the right message out there. I also think it's important, again, as a researcher, to generate evidence on the effects of mask wearing through research and objective data analysis. There's so much misinformation out there. So what we as future policymakers or as voters or informed members of the public should do is to look at the hard evidence whenever possible. So we can go straight to the source, go to Google Scholar, read the studies directly. There are a number of studies out there already which show that wearing masks does reduce transmission. And then finally, bringing it down to a personal level, how can each of us change our own rhetoric among family and friends, social media, whatever our circle of influence is, to help de-link political affiliation from what should be normal, healthy behaviors. And that's something I appreciate about the work of No Labels, and I'm sure that good ideas will come up during this discussion as well.
Thank you very much, Aparna. Just a reminder for everybody that if you have any questions, please just go ahead and throw them in the chat bar. We actually do have an opening question here from Lisa Manning. And her question is, in light of the recent protests, the vastly differing views and reactions of Republicans and Democrats, do you see a way forward on the race relations issue? And Kareem, let me come back to you because one of the things we saw notably over the summer in the wake of the killing of George Floyd was there was a real movement afoot to get substantive criminal justice reform in DC. And you saw Democrats in the House passed a policing reform bill. I think it was called the George Floyd Justice and Policing Act. And then the Republicans, led by Senator Tim Scott in the Senate, were moving their own alternative. And as is often the case in Washington, it was like they were just whistling past each other. None of the they never were able to connect it and turn it into an actual bill. So if you think about that, Kareem, and you think about maybe going into early next year, where do you actually see common ground where you could see a bipartisan consensus emerge behind really substantive change on some of these race relations challenges?
You know, that's a great question and an interesting one. You know, sometimes as time goes on, you think things are easier to do. Unfortunately, I think that as time has gone on, that made things more difficult to do. Um, and here's my reasoning for it. In the age of, I mean, politics are always, and different sides are always sometimes very far apart when it comes to some things. But we can't even seem right now to get to a basic understanding of what the real facts are. You know, the facts are that regardless of what the reason for it is, the facts are that not only, you know, specifically people of color, but specifically it's talking about issue with George Floyd, specifically Black folks are more likely to experience these negative outcomes with policing, with use of force, with whatever their sentence is whenever folks are convicted. You know, we can't even agree that Black folks are more likely to experience these negative type of outcomes. You know, Black Lives Matter, for instance, that's the whole thing. There's this implicit too there, you know, that Black Lives Matter too. You know, it's not saying that white lives don't matter or Latinx lives don't matter or blue lives don't matter. Folks aren't saying is that Black lives matter also. Those other lives have a lot of value. Black lives has value also. But now that has turned into this political thing where folks say, well, Black lives matter. Let's draw a relationship between that group and Antifa. Folks say Black lives matter. They're terrorists. They're this. You know, we can't even. So even that started to shift where now, depending on who says Black lives matter, folks will say, oh no, they should matter or do matter. Other folks say, you know, depending on what side of the equation that you're on, it has this negative type of connotation to it that wasn't there at one point. So I think it's hard. I think it's really hard. And now Democrats and folks in GOP and the GOP are playing to their base these days, and it makes it hard to come together. And honestly, I was not expecting this. I wasn't expecting to get, you know, I wasn't expecting to be as far apart as what it seems to be right now, because it makes it very hard to do things. Because if the GOP said, okay, we're going to come up with some policies, procedures, we're going to do something that recognize that Black folks, that folks in the Latinx community are disproportionately more likely to have these outcomes, then their base will say, oh, you're trying to appeal to the left. And honestly, I think it makes it much harder. But until people just agree to what the facts are, and the facts are clear, until people agree to what they are, folks can have a disagreement in terms of how to get there. But until we agree on just the basic facts, it makes it very hard to see a way out of this. Do I think it could happen? Yes, but people obviously at some point are going to have to be willing to stand up to their base in order for that to take place. If we can do that, my hope will increase greatly.
Yeah. You know, you all kind of make an interesting point, and Taryn, I want to extend this maybe to your experience as a teacher. So Kareem was talking about how difficult it is for us to just agree on any sort of fact set. Do you all sort of find that in your teaching? I mean, with students, that like, is there? Do you sort of do you sort of come in and you sort of find that you're having difficulty getting people just to agree on a common fact set, let alone trying to talk about how to interpret that fact set?
Not necessarily. I mean, it's certainly not in the, you know, the undergraduate or master's classes I've taught. I feel like I teach classes largely on child and family policy or health policy, which are areas where overall they're quite politicized. Obviously, health policy is. But when you get into the weeds, there's not a lot of this is blue and this is red. There are lots of gray areas where there's not right and wrong answers. There's different policy decisions that could be made. And I encourage students to they write policy memos about evidence, right? And so you can have opinions, but I want you to base it in evidence. You could take different policy approaches, base it in evidence. And so that's what I try to emphasize. And I worked on the Hill about a decade ago on health issues, and it was similar then too. And when you're in an interpersonal relationship, and you're face to face with somebody working on something, it's just a different dynamic than the political kind of punditry more in the media or in social media when people are just typing something and it goes out into the ether.
Yeah, right. Well, I mean, we have a follow-up question here from Julie Thompson-Dopkins, and she says that unfortunately, I am not sure that the facts are, quote, clear to everybody. Seems obvious, but some can't seem to see the issues that are plainly there to many of us. And Kareem, I want to pivot this question a little and ask you this, is that I know this is a challenge that so many scholars have looked at, that when you have somebody who believes something that is objectively untrue, it can actually be very hard to convince them to move off that position. In fact, there's been some studies I've seen that the more you expose them to the correct facts, the more sort of rooted they get in their wrong position. And so you talked about your frustration with, some politicians who you just can't seem to get through to agree with this baseline idea that there is a problem. Is there any ways you've thought about different ways to communicate that you found to be effective to break down walls with people that maybe previously you weren't able to reach, and you found some techniques that work?
Yes, this is probably more on a personal level than a professional level, but yes, sometimes people just don't see things, and that includes myself also. Sometimes people always think about conspiracies. The data are collected in such a way in terms of there's this deep state, and I'm not saying that as a slight against Trump, just saying that people really do believe that you got these social forces out there that's trying to have the data look a particular type of way, that there's the structural thing that's trying to convince people that certain things exist that really doesn't exist. But in terms of being able to help people break down walls, for instance, I'm from inner city Philly. I'm a Philly guy down to my core. And I'm used to the things that I see in Philly. It's a big city, it's very dense. And in terms of the view, for instance, just of middle America, whatever middle America may mean to folks, I really had no knowledge of and everything else. But until I start going into some of those communities and understanding how people can feel left out, how people can feel like their issues are not being heard and everything else. So sometimes experience is that thing that really helps to break down walls. So not just talking to people, the data says this, but actually taking people into those communities, and not just inner cities communities or Black communities or Latinx communities or Native communities or your rural type of communities. But yeah, I think that sometimes people seeing and being exposed to things can help at least break down that wall enough where people will be able to listen. It's very easy to dismiss things if you haven't had a chance to experience the people behind those things. Behind all of these numbers and data, real people experience these things with education and healthcare that the other people are talking about. The other people on the panel are talking about, they're real people behind those. So people actually have a chance to actually see those real people experience what those numbers will represent. That, at least to the circle of people that I'm around and to myself, that was able to help break down some of what I thought at one point with people not being able to see past things or understand what the facts are.
Yeah. This leads me to a question for Aparna, which is, this is a particular challenge in this moment with public health, which is so much of what a public health researcher does is focusing on the facts and the data. And yet it's become so clear at this moment that the facts and data alone don't necessarily change behavior. To actually persuade people, it does have a lot to do with how you communicate. And so, can you talk through maybe since maybe the beginning of the pandemic, how your thoughts have changed in how public health priorities need to be communicated?
Sure. So I think that's absolutely true that in the area of health, it seems that the facts are less easily disputed in the sense that we have data on what insurance rates are. I think that we can all agree on a few things. Most everyone would probably agree that healthcare in America is too expensive and that the return on our healthcare spending dollars is too low. I think both sides of the aisle would agree that compared to other wealthy developed countries, we spend more than twice per person on healthcare. Yet our outcomes are not any better than other developed countries. In fact, they're consistently worse in terms of life expectancy, infant mortality, prevalence of chronic disease. And we all know that such a situation is a real threat to our long-term well-being and that something must be done. I think where we disagree is about how to get there. Yeah. And I think in terms of where we go from here, we should understand that people have different political views, and that diversity is a wonderful thing. It's essential for our democracy to work, for progress to happen. And we want some people to be conservative. We want some people to be liberal. I come from an economics background, and we learn in economic decision making, one of the basic principles is that even if we use the exact same formulas or the exact same cost benefit formula trying to maximize social welfare, different people will prefer different situations because preferences are different, right? People value different things differently. And sometimes what happens is our identities just become so strongly tied with a particular political party or ideology that we're predisposed to see nothing positive in the ideas or points brought up by the other side. And I think that this can make us all defensive and glued to our ideas even more. We've seen this happen with the debates to repeal and replace the ACA. I think it's great to have our ideologies and have our loyalties, but when it comes to science, when it comes to health, being able to independently evaluate ideas and policies on their own merit, regardless of who originated them, who's supporting them, it's very important to being able to move forward and create the best policies for the country.
I want to invite us all to put our political hat on for a second here and ask a question that is very no labels in nature. And this is a question from Robert Braun, and this is a question for you, Taryn. He just says, I don't see much bipartisanship in the future based on what has happened with the rush to fill the Supreme Court vacancy. And look, Robert makes a really interesting point in that there is this tit for tat game that the parties play now in which they absolutely push to the limit the power they can exercise, and they just show no quarter for the other side. And in response, the other party feels a need to respond in kind. So my question to you, Taryn, is really twofold, which is one, do you agree that you don't see much prospects for bipartisanship in the future? And number two is, if you don't, does it matter? I mean, do you think the goal of bipartisanship is one that still has relevancy at a moment like this?
I do think bipartisanship has relevance. I would argue that potentially both parties haven't been equally culpable at maximizing power, and one side has accelerated more so than others. But we are where we are. I would also say that at an individual level, whether I think it's legislatures or staff, or and certainly when you get to the state and especially local level, people have relationships and interconnections, and they find common ground. Maybe not necessarily in places where you might think, but also in very, very important ways. So there are bipartisan bills. There are bipartisan policies. I mean, we've made pretty important strides, for example, in childcare funding. So childcare subsidies received an historic increase in funding for fiscal year 2018. And that, was great, I think. And many people across the aisle thought that was wonderful. And in 2014, the childcare block grant was reauthorized. We had the Early Student Success Act, which reauthorized what used to be known as No Child Left Behind. Those are all bipartisan bills, and they all, included policies that went across the political spectrum and compromise. And that's how our system's designed to work. It's a lot more polarized, obviously, and those who are elected are beholden to their constituents. So, I think it's up to us to vote and to hold our elected members accountable. And I don't think it's okay to write it off as just political polarization. I think we have to, as Aparna said, look at the details of policies. We have to judge them on their merits, and we have to be clear of where we're getting our evidence and take responsibility for that.
Yeah. A reminder to everybody that if you do have a question, you can put it in the chat, and I'll be happy to ask it. But my next question is for Kareem, and I want to talk a little bit with all of you about just sort of innovative policy thinking and ideas that you think could sort of break log jams on difficult issues. And as an example, one of the things when we were doing some research about what are instances where you can achieve a bipartisan breakthrough, where maybe you bring people to the same endpoint, even if they get there for different reasons. And one of the great examples we found was actually at the end of 2018 in the First Step Act, which was the biggest federal criminal justice reforms in decades. And what you saw there was a very unusual alliance between progressive social justice groups on the left who were coming at the issue from that perspective, but also conservative groups on the right, most notably the Koch network, who were saying, the mass imprisonment that we have in this country is a major drag on state budgets. It destroys economic opportunity in local economies. And so even if the motivation for the parties to get there may have been different, they got to that same place. And I'm curious, in the issues you care about, do you see any other instances on the horizon where you could kind of hit that sweet spot where there's just enough agreement, even if it's for different reasons, on a major issue? Kareem, I'll start with you.
I do. The First Step Act was good. And even before that, now Congress several years ago reduced the sentencing disparity between crack cocaine and powder cocaine. They reduced that, and they received bipartisan support also, and those are good. I'm hesitating because, bipartisanship is good, but bipartisanship, sometimes people look at what was able to get accomplished and think that the issue is fixed at that point. Bipartisanship on the disparities between how you sentence people for crack and powder cocaine is a good thing. The First Step Act is a good thing. Now, the First Step Act, that impacted people who were sentenced at the federal level. Most people are incarcerated are impacted under state law, not federal law. That doesn't mean that, that Congress shouldn't try things. Of course they should, and they can have these different types of incentives for states to follow suit, which is a common thing. So to me, bipartisanship is a good thing, as long as people recognize that the issue isn't fixed. Sometimes when that occurs, the people who suffer behind it are the communities who've been disenfranchised for a significant period of time. Black communities, Latinx communities, your communities that have fewer resources in terms of money, folks who live in communities where the schools aren't necessarily funded as well. Those are the communities that typically suffer the most. So bipartisanship is a good thing, but many times it don't have the real impact for the real people on the ground, who have been disenfranchised for generation after generation after generation. So that's is not necessarily a downside of bipartisanship, but it is a reality of it.
Yep. Well, I'll tell you what, Kareem, that's a great point, and I want to use that point to ask Taryn. I want to ask you a more targeted version of that question. So we're talking about innovative policy thinking that maybe could hit that bipartisan sweet spot. And you mentioned in your opening remarks this idea that kids and families should really be at the center of so much of our policy making. Is there an idea that could hit this bipartisan sweet spot? And the reason I'm asking is not because of a fetish for bipartisanship, because often that is what it takes for something to become law, but that would move the needle enough, that would be big enough to talk to use a little baseball analogy. I think what Kareem is describing is, there's a lot of bipartisan ideas that move, and they're nice, they're singles, they're doubles. They are not a home run. They do not really get at the underlying issue. So if we're talking about kids and families, if we're talking about inequities for kids and families, is there a transformative idea you see on the horizon that you think both parties could buy into that would really make a difference?
I'd say I would kind of classify policies as like immediate COVID responses and then kind of long-term change, and they're obviously interrelated. But for immediate COVID responses, I know there's political will on both sides of the aisle to help communities and school districts and families who are struggling with unemployment, who have physical schools that are just underinvested for decades. School spending hadn't bounced back since the Great Recession, and then you have problems with ventilation, is all the more important right now. So I think, resources to school districts that would go to school districts across the country would be really helpful in getting kids back to school. Then parents could work, right? When kids are at school, parents can work. Right now, we have 1/3 of our workforce has caregiving responsibilities. And so with so many kids out of school and then childcare centers closed, the childcare sector is largely decimated. And that could be another area of bipartisanship. We saw, as I mentioned, that in 2014, we reauthorized the Child Care and Development Block Grant, which provides childcare assistance to low-income families. We could extend that. We could invest in childcare and get parents back to work, as well as creating jobs. It's a job creation on multiple levels. You have the childcare sector, you have parents, right? Allowing them to work. So I do think it's encouraging. And early childhood has been a bipartisan issue for decades. You have Oklahoma and Georgia were the first states that created universal preschool programs in the 90s. Those aren't blue states. They still aren't, and they weren't then. And so now we have West Virginia and Vermont and the District of Columbia. Those are the places where nearly every kid has access to preschool. That's a motley crew. So I think there is, there are encouraging developments, particularly for young kids.
Yep. Aparna, similar question to you, but I want to put this through the lens of health, which is, if nothing else, this COVID epidemic has made so clear we still, notwithstanding the coverage expansions in ACA, the Affordable Care Act, there's still a lot of coverage gaps. There's still a lot of people who need care and can't get it. There's still a lot of people who may have access to care, but they can't afford it. When you start to look at early next year, it is so obvious that this will be something that comes in front of Congress in one way or another. Are there, same question, kind of transformative, innovative policy ideas that you think maybe could bridge this partisan divide, that you could sort of see a critical mass of members of Congress getting on board with?
Sure. So like my fellow panelists, I would say that I am hopeful about some things going forward, although the situation does seem bleak. I think there's been some examples of successful bipartisanship healthcare legislation in the past. For example, the young adult mandate portion of the Affordable Care Act, which allows people to remain under their parents' private insurance plans until age 26. That enjoyed bipartisan support. Many people were in favor of that particular mandate, even if they weren't in favor of other aspects of the Affordable Care Act. As you mentioned, Ryan, we still have about 10% of our population uninsured. And going forward, it seems that the mechanisms to insure them, or the proposed mechanisms to insure these people are slightly different on both sides of the aisle for sure. But I think that in terms of at least reducing healthcare costs and making healthcare more accessible to people, it's encouraging that both sides seem to see this as a major issue. So both candidates, if you read through their healthcare plans, they do bring up the rising healthcare costs as an issue. Both support the development of alternative payment models, the movement away from fee-for-service payment, which has led to increased prices. They both support prohibitions on surprise billing. Surprise billing is something that happens when a hospital that you see is part of your insurance network, but you might have been treated by a practitioner who wasn't part of your network. Of course, you had no way to know this, and you receive a huge bill in the mail. So they both see, reducing healthcare costs as a major issue. I think another area where we can be optimistic is addressing the opioid overdose crisis. So the opioid crisis that we're in, I'm sure we're all aware, literally tens of millions of people are affected by this. We have about 50,000 opioid overdose deaths each and every year. For both President Trump and Vice President Biden, they have proposed actually a very similar plan to address the opioid overdose crisis. They both revolve around increasing funding to expand treatment programs, expanding access to naloxone. President Trump had declared the opioid crisis a public health emergency and allocated additional funds to provide treatment. The Biden plan also mentions the opioid crisis and wanting to reduce unnecessary opioid prescriptions and holding pharmaceutical companies responsible for their role in the opioid crisis. I think in terms of how to really reduce the coverage gap, though, there are some differences in approaches. For example, Medicaid enrollment, which jumped during the Affordable Care Act, did fall in the first couple years of the Trump administration. It bounced up a bit since the COVID-19 recession, but there's been a real encouragement from the Trump administration to change and to limit Medicaid eligibility through work requirements, versus the Biden plan proposes retaining the Medicaid expansion as is, and in fact, expanding insurance options for low-income adults in states that didn't choose to expand. So I would say in terms of reducing healthcare costs, we do see ways to move forward in a bipartisan way. Where we need work on is really how to reduce the coverage gap.
Yeah. It's interesting, as I listen to the three of you talk, and you each sort of just detailed some pretty substantive changes that really could happen in regards to criminal and racial justice, in regards to healthcare, and in regards to education. And yet there is something that it falls down along the way, in somewhere between a good idea and actual law, and it never gets there. And there's a question here from Mao Yu that I want to use as a jumping off point to a broader discussion about this. And he says, based on the ever-increasing political polarization, partisanship seems to be an impossible task. How much do you think you can allow a more moderate third party to grow rapidly and become a buffer for polarized politics? But I want to expand the scope of that question a little bit. And I'll start with you, Kareem. And it's basically this. All of you have been doing what you're doing enough to know and to experience the frustration of coming up with some research, coming up with compelling conclusions, and then seeing policy that would meaningfully move the needle on a problem, and then it goes nowhere. And we all know in our system, there is policy and there is politics. And even when you agree on policy, sometimes the politics get in the way. And so the question I'd love to ask each of you is, are there political reforms that any of you like, that you think would clear the way for more effective policymaking? So Mao, you mentioned the creation of a third party, but as you all know, there's a whole suite of reforms to how we vote, to how the House and Senate, structures its rules, to how we run our primary elections. There's all these kind of structural fixes that are out there that some people have suggested, hey, if we fix these political problems, we're going to get better policy outcomes. Kareem, is there any that you find particularly compelling?
That's interesting. Even though I'm a criminal justice person, I definitely love politics tremendously. I think some things can be, the filibuster, let's say, getting rid of that, like for real, getting rid of it. I think that would make policies easier, but then it will become more partisan, because when parties shift, then different things will happen. So I think that's one way, but that comes at the consequence of that is very huge. Honestly, personally, I think that things are better on the local level. Honestly, I think that you're more likely to find people on the ground being willing to work together and find bipartisan solutions there. By the time you get to, the White House and Congress, there's a different level of politics there that doesn't exist anywhere else. So honestly, truth be told, I think that, and honestly, we're more impacted by what happens with our city council and mayor and the governor as opposed to what goes on here in DC. So honestly, truth be told, my honest opinion on this one, I'll be short with it, is if we concentrate on our efforts and what's going on within our local school board elections, if we concentrate on efforts in terms of what's going on with city council, and trying to fix or at least help address the issues that's going on in our schools, which of course is influenced by Congress and state, and the state also. But to me, we concentrate more of our efforts on what's going on around us as opposed to what's going on several degrees away. Honestly, I think that life will be much better. I care about what goes on in DC tremendously. But I think we need to refocus the efforts that we're making and try to find out what we can do on the ground for the people who are next door to the person who just got out of prison, to the person who's not doing well in school, to those, so to me, we can concentrate more of our efforts there. Because I think we lose focus when we concentrate, when we concentrate more on what's going on in the White House and within the House and Senate, So to me, yes. So I think we need to have more of our efforts local.
That's a great point, Kareem. And I would invite everybody, when you take a look at your ballots this year, and I assume everybody is voting, and if you're not, then you're not my friend, and we're not going to be talking because you need to vote this year. But you're going to find, I know the headline is the presidency, but there's like 15 other offices on there that you're going to be voting for. And all of them are going to have, to Kareem's point, probably a lot more significant impact on your day-to-day lives than maybe even your presidential vote. Taryn, political and structural reforms. Is there any that you think about that would move the needle?
Definitely. And I am also not a political scientist by training, but I have a lot of opinions about this. I think I completely agree the local and state level is super, super important. I also agree with getting rid of the filibuster. I think then people would, candidates would have to run on realistic plans and then have the opportunity to actually implement what they run on, whether it's wide scale change or it's repeal, but we could, as voters, hold them accountable for that and then switch. It might lead to more back and forth, but I think we'd get somewhere. We'd have the people we elected implement the plans that they ran on, as opposed to not being able to do anything. I live in the District of Columbia, and I have for 12 years now. I don't have a senator. I don't have a congressperson, yet I pay the same amount in taxes as anybody across the border in Virginia and Maryland. So I think, DC statehood means a lot to me personally, but also structurally. I mean, if we have a larger population than Wyoming or Vermont. So, if 700,000 people in random, area in Nebraska were disenfranchised, I think we'd all think that was a problem. So DC statehood means a lot to me. I think we should make Election Day a holiday. People should have it off. We should make it a week long. We should have automatic voter registration, make it easy for people to vote. So yeah, all those things.
Great. And Aparna, your thoughts, kind of political structural reforms.
Sure. So I'd just like to say I agree with Kareem and Taryn completely when it comes to thinking locally, really thinking about our circle of influence and how we can make change there. Of course, trying to expand our circle of influence is important too, and I think that that's what brings many of our students to AU. But just at each level, thinking of where we can affect change and how we can do that most efficiently. In terms of structural reform, so this isn't necessarily political reform, but just thinking about how we think about health and healthcare and improving health in the US. I think there's that old saying that an ounce of prevention is worth a pound of cure, and that's certainly true in the US. I feel that there's not enough attention being given to preventive care, to maintenance of chronic disease, and we see that result in high healthcare spending, and that's really an area where I think there can be some structural change in the healthcare system.
Okay. I am mindful that we are coming up on 5 o'clock here. I will check in with Lisa, our keeper of the time. Lisa, do we have time for another additional set of questions, or should I close up here?
Unfortunately, we have about 2 minutes, so if it can be brief.
Okay, so how about, let's do lightning round. We're going to turn this into a game show. Kareem, just any closing thoughts you'd want to have for the folks on the call today? We are, as of today, almost about 3 weeks from the election. So things they should be thinking about as we go into the home stretch here.
Absolutely. I'll keep it extremely brief given the time. I will say that make sure that you vote. If you can vote, do vote. Not everybody has the ability to vote for different reasons. So I would say if you can vote, vote. And take a strong look at what's going on at the national level, as long as as well as your local elections, because again, those things are going to influence you much more. So just please be engaged and please vote.
Thank you, Kareem. Taryn?
I completely agree. Please vote. Please research your local candidates, whether it's a local newspaper. It might not exist anymore, but try to do your best in terms of getting familiar with who's running, why they're running, and what they're going to do.
And Aparna?
So thinking in the short term, we certainly want to think about addressing the COVID-19 pandemic, but it's also important to keep an eye in the long term, looking at healthcare and other issues beyond COVID-19. How can we increase insurance rates, lower healthcare costs, improve health outcomes? And I'll borrow Julie Thompson-Dopkins' words from the chat box: don't lose hope, don't give up. Thank you, Julie.
Yes, Julie, I don't know you, but those were the most inspiring and perfect words to end on. So look, I want to really thank Kareem, Taryn, Aparna so much for sharing your thoughts today. Thank you to Vicki and Lisa and the AU team for pulling this together. A reminder for all of you that if you are interested in learning more about No Labels and the work we do, you can do so at nolabels.org. But I will close as with the same thoughts as my fellow panelists, which is we always say we are the greatest democracy in the world, and so let's prove it. And let's all go out and make sure we vote, and make sure if we have an ability to encourage or enable others to vote, that we do so. Well, thank you so much, and everybody have a nice day.